Okay, good afternoon, everyone. Oh no, he's gonna advance my slides. So I'm Dr. April Joy Damian. I trained at Harvard Medical School and Johns Hopkins School of Public Health as an epidemiologist and health services researcher. And so today I'm going to first start with my why and the motivation for my global pitch. So next slide, please. So in July 2020, I became the first Filipina as part of my organization's executive leadership. In its 50 plus years of existence, they've never had a Filipino woman in their executive leadership. And so, thank you. So not only was my presence in my organization unprecedented, but July 2020, if you can think back at that time, the issues we were facing in healthcare, right? So not only was I helping combat misinformation and addressing the COVID-19 pandemic, we were educating over 25,000 healthcare workers across the US who are working with the most marginalized populations in health centers. I was talking with policymakers as we were talking about racism as a public health crisis given the murder of George Floyd. And we were also talking about, since my training is as a psychiatric epidemiologist and my research focuses on childhood trauma, the ongoing youth mental health crisis, right? So all of this was happening at this time, and a very important time to talk about health equity and justice. So next slide, please. There was one meeting in particular. I flew out in Seattle in the middle of the pandemic, and I met this Filipina indigenous healthcare administrator who in my roundtable, she said, quote, "We have been so focused on everyone else's needs, protecting and saving lives." And she said, "What about us? What about our mental health? Who is telling our story?" And so that really stopped me in my tracks because I was so busy trying to do my best as the first and only Filipina at that time in my organization. I was thinking about what it was like to live in Washington, D.C., because on January 6th, if any of you heard about the insurrection, there were actually some folks outside of my house who were unfamiliar and used some derogatory terms, right? And I never really processed that until she said this, because I was just so focused externally, and that's, I think, ingrained in our service mentality. Next slide, please. And so the solution I came up with is Photo Voice. So Photo Voice is a grassroots approach that combines photography with social action. So it's a 5-step process. First, there's a 4-part training in Photo Voice. The second is that Filipina healthcare workers in the US, which is the target population I'm focusing on, take photos that show the barriers and opportunities to promote mental health, specifically of Filipina healthcare workers. They then meet with each other in a virtual format to discuss and give each other feedback on the photos and the narratives behind those photos. There's an advocacy piece where they talk with local policymakers, fellow researchers, as well as other professionals in the healthcare field about recommendations to address our mental health. And then the 5th is the sustainability piece, which was asked in my interview, is the formation of a Filipina healthcare worker mental health group to operationalize the recommendations that were come up by the participants in my project. Next slide, please. So the underlying magic of my project is threefold. So this is the first project to do each and all of the following. So I want to intentionally build and strengthen the advocacy capacity of Filipino women healthcare workers, or HCWs, in the US through Photo Voice. So we as Filipino healthcare workers go through years, sometimes even decades of training, I know this, but rarely does that training include advocacy. So I want to change that with this project. Second, I want to uplift the mental health issues and the diversity of roles and social identities of Filipino women HCWs in the US as told from their own lived experiences. I highlight diversity of roles because even in this powerful room, there were entrepreneurs, nurses, physicians, research scientists like myself. And we also embody, and I appreciate the prior theme of intersectionality, many social identities that impact our mental well-being, and to actually have the space to create and talk about these issues. Then the third piece is forming the work group that I talked about earlier in terms of collaboration to seek support, both financial as well as non-monetary, to operationalize these solutions and key recommendations, right? Because in advocacy space, we say nothing for us without us. And so how do we make sure these solutions that are come up with are operationalized? Next slide, please. And so I'm very proud. I start out by saying I'm the first and only, but I'm not the last, right? So since becoming the head of the Weitzman Institute, I've recruited other women of color, particularly Filipinas, across the US. And so my team is now predominantly BIPOC, so Black, Indigenous people of color, team led by PhD-trained Filipino women, right? So Dr. Yamazaki, she's has expertise in workforce development and community engagement. Dr. Arestar has expertise in program evaluation and intersectionality, so they will co-lead the project with me. And then Tonantzin Juarez and Ryan Kern have 30 plus years of expertise in photography and health policy. And so we will be the team driving this project. Next slide, please. So this is a 24-month timeline. So you see the first 6 months are focused on recruitment and training of the participants. I wanted to account for drop-off in case there's some folks who aren't able to finish the training. They'll create multimedia products. I've done this project, I've done Photo Voice in the past and have published on it, but want to do a different focus on this topic. So we create different multimedia projects, right? From policy briefs, podcasts, a traveling photo exhibit. They'll engage in dissemination efforts, including a national webinar during Filipino Heritage Month. So Weitzman Institute, we have 80,000 subscribed to our listserv, and we usually have 500 to 1,000 live attendees who attend our webinars. That's not including those who register and view it later. And then the formation of the mental well-being of Filipino healthcare workers work group, because I know there's more to be done beyond the 2-year project. So next slide, please. So my ask is $150,000 US to cover different expenses, from the personnel, recruitment, remuneration, because we want to make sure to also compensate our participants for sharing their lived experiences, the training for the supplies, and then dissemination, which includes traveling, because I want the Filipino healthcare workers who participate to be the ones at the forefront of being able to disseminate this knowledge. Next slide, please. So I have a handout with this, and then this is the QR code for my LinkedIn. So I just really appreciate being in this space with all of you. And thank you.
Fantastic. Thank you so much. Do we have any questions for Dr. April? Yes, Teresita.
Amazing project, but what will you do if you're not able to raise this large amount?
So can't is not in my vocabulary. So my organization, I already brought this up to them, and they said they would already provide in-kind support, so I would have committed protected time to do this, because health equity is so central to the work we do at Weitzman. So they said they will cover my time, Dr. Restar, Dr. Yamazaki. And I also have a grants person. We actually hired a new VP of Strategic Partnerships and Development, who will then go to foundation. So that's why I said can't is not his vocabulary. So if it's not in this space, I will find a way, as I have done in other things in my life.
My kumare, just like it was love at first sight yesterday. Actually, I really loved her the first time I saw her. Would you accept in-kind donation? I'm committing my company to do all your videos.
Oh yes, please. I forgot that part out of excitement.
Yeah,
I'm
yeah,
accepting non-monetary, however you can drive this. Don't know, but both of my kumaris, I'm already recruiting them to participate. So, but yes, please, thank you.
Yes, I'm committing our resources for you.
That's fantastic. Wow, that's great. Ellen?
I need this document.
Ellen? Yes. All right. You have witnesses, Ellen?
Hi. Well, wonderful presentation. Thank you for that. How applicable would this be to other health professions? Because Filipino women are really prominent in a lot of our healthcare sectors, and I'm curious if there is any thought about applying this to others.
Just to clarify, like other women or other.
Health professions.
So yeah, my definition of healthcare workers is very inclusive because I think that so many times that when we talk about the media covers Filipino healthcare workers, and I tried Googling this, right? Usually it's a Filipino nurse, right? And I have those in my family, right? My cousins are nurses. But it's to say that that's why I highlighted my second, the underlying magic, is that I want to make sure that in addition to Filipino nurses, that people realize that we also hold other positions in healthcare, right? Like policy drivers, entrepreneurs, like Vanji, who are both, right? Like I'm like CEO, founder, slash nurse, right? And so I think I really want to educate and raise awareness to the public, right? Terrace, who interviewed, I thought that was a hard interview, but I mean, but I mean, like, educating like the Biden-Harris administration on how to make sure we're represented in the data, right? Like, and I don't think our stories and our the positions we hold in healthcare are emphasized enough. And so I just really want to make sure that different professionals, the Filipino women who hold different professions, not just in the front line, but the C-suite and in other spaces are represented. Did that answer your question?
I think in my head, when I saw the acronym, I was thinking community health worker.
Oh,
Specifically,
CHWs.
yeah,
Yes.
because I don't know, I think it's because public health, and it's a lot of public health professionals focus on that workforce, so I think that was just me, like,
Oh, okay.
automatically assuming.
Yeah, HCWs, not CHWs. But then if we have Filipina CHWs, I'll include them too. Yeah, that's very inclusive. So anyone who's in the healthcare sector who identifies as a Filipino woman is part of that group.
Fantastic. Yeah, that's amazing. Thank you so much, Dr. April. All right, so ladies, what do you think? That was an amazing first day of global pitches, right? You have one more question?
I was just wondering, is there like baseline information about